Over the past 2 weeks, we've been out with local campaign groups trying to raise awareness about major cuts to local health service. It's estimated that over the next 4 years, Oxfordshire could see spending reduced by around a quarter. If that sounds like a lot, it is. Taken with the cuts we've already seen, it'll be a reduction of around a third. So far, most patients haven't seen much difference. If you're lucky enough to be healthy, you may not have noticed any difference at all. But this time it's going to be different. There are a number of factors that make this more likely. Firstly, the NHS has already absorbed a huge amount of cuts. At the beginning of the 2010 Parliament, the coalition government promised to maintain spending on the NHS in real terms. However, growth in need meant that by 2015, nearly £20 billion worth of savings needed to be made. Commissioners did this mainly by passing on the cuts to the organisations that provide NHS services. New contracts paid them less and asked them to do more. But when they were asked to do the same again in the 2015 to 2020 period, the cracks started to show. At the beginning of this financial year, NHS providers were experiencing record levels of deficit. The consensus is that it's simply not possible to make these kind of savings again. So NHS England has taken a different tack. NHS England has divided the country into 44 footprint areas and told them to make plans to break even by 2020. All footprints have leaders who have not been democratically elected and don't seem to be publicly accountable. What's worse, the plans were agreed with NHS England before they were made public in November of 2016. If you're wondering why you haven't heard about what's happening, this is probably why. It seems that the NHS is very keen to get the plans agreed before the public finds out what's in them. Most of the plans are very vague and only give a direction of travel. Many contain good ideas like closer working between the NHS and local authorities. However, it's clear that these won't produce savings anything like the £22 billion that the government wants. From the analyses produced by The Guardian, the Health Service Journal and others, it looks like the majority of the cuts will be achieved through the closure of local and community hospitals. Some services will be centralised to other big general hospitals, while others will be distributed into primary care. This has caused alarm amongst activists in Oxfordshire, as many of us have been involved in long-running campaigns to protect the Horton Hospital in Banbury and the community hospitals in other parts of the county. It seems like the temporary downgrading of maternity services in Banbury, apparently due to staff shortages, was in fact part of long-term plans to downgrade the Horton Hospital. As soon as details of the plan leaked out, 45 GPs working in the north of the county wrote an open letter to the County Council's Health Overview and Scrutiny Committee. The letter expressed their concern and dismay and urged everyone involved to act now to prevent what they called an ill-conceived and short-sighted action. We join members of local campaign groups over the next 2 weekends, handing out leaflets explaining what little we know about the cuts and telling people what they can do to try and prevent them. Luckily, there are formal consultation processes that have to be followed before the cuts can be made. Unfortunately, though, commissioners have only allowed 3 months in between publishing their plans and putting them into action. So over the next 3 months, we'll continue to work with other local campaign groups to try and get to the bottom of what's actually being proposed. And if it does turn out to be 10% efficiency savings and 90% cuts, instead of the other way round, we'll work to oppose them.